My name is Helai Gupta and Senior Consultant Obstetrics and Gynae with Rosewalk Hospital, Panchsheel Park, New Delhi. In this video, I will attempt to address your concerns about pregnancy-induced hypertension, or what we generally call as PIH. Before that, what is normal blood pressure? Normal blood pressure is recorded as 120 by 80 millimeter of mercury. Anything above 140 by 90 or below 90 by 60 is a matter of concern. Now, what is pregnancy-induced hypertension? Pregnancy-induced hypertension is when the blood pressure is recorded for the first time as above 140 by 90 after 20 weeks of pregnancy, and it's associated with presence of protein in the urine and or presence of elevated liver enzymes and low platelet. Why is it so important to diagnose and prevent pregnancy-induced hypertension? That is because the physiological changes of pregnancy as it is puts the maternal heart and kidneys under a lot of stress. And when the blood pressure increases, it further compromises the function of heart and kidneys. This can result in adverse effect not only in maternal health but also in the development of the fetus. This can result in reduced birth weight, growth restriction, preterm deliveries, and at times fetal demise. In the mother, if the pregnancy-induced hypertension is not controlled, it can further progress into what we call eclampsia. And in this condition, there can be convulsions and fits and very high blood pressure, and it can result into kidney failure, brain hemorrhage, coma, and even maternal death. So it becomes very important to diagnose and treat pregnancy-induced hypertension as early as possible. Who are at risk of developing pregnancy-induced hypertension? Those with family history of high blood pressure, those with family history of pregnancy-induced hypertension and eclampsia, those who had pregnancy-induced hypertension or eclampsia in their previous pregnancy. Also, obesity is a risk factor. Increased age or early pregnancies like teenage pregnancies are also prone to developing pregnancy-induced hypertension. Multiple pregnancies like twins and triplets, those who have pre-existing high blood pressure or pre-existing medical condition, they are also at the risk of developing pregnancy-induced hypertension. What are the symptoms of pregnancy-induced hypertension? The most common symptom is headache, blurring of vision, and nausea, vomiting, epigastric pain, sudden weight gain and swelling, and also a lot of other biochemical changes in the blood tests and urine examination. Can we avoid pregnancy-induced hypertension? Well, up to a certain extent, we can avoid it, but the good news is that by early diagnosis, we can prevent almost all complications of pregnancy-induced hypertension. And for early diagnosis, we must have healthy lifestyle like adequate rest, exercise, avoid smoking, good nutrition diet, a nutritious diet, and also early pregnancy checkups and antenatal visits. This can go a long way in preventing pregnancy-induced hypertension. Fortunately, nowadays we have certain tests available which can diagnose and predict pregnancy-induced hypertension as early as 12 weeks of gestation. And once these high-risk patients are diagnosed, then we can put them on surveillance and we can advise them appropriate lifestyle changes and prescribe the required medication, and we can prevent further deterioration and complication. And we can ensure safe motherhood and healthy pregnancy outcome. Here is wishing you safe pregnancy and healthy journey.